This module covers how to write a case report. The first step in writing a case report is finding an interesting case that's worthy of publication. There are a lot of interesting patients, scenarios, and cases out there, but not all of them are worthy of publication, and it can be a challenge to find one that is. Case reports are really easy to write. In fact, you can sometimes get it done in as short as a day, but the challenge with case reports is finding someone who wants to publish it. So you want to look for what makes yours unique, unusual, interesting. What are the clinical teaching points? Sometimes it can help to shadow physicians and build connections so that you might see a patient together that's interesting, or they might think of you even when they're seeing patients and you're not there. That relationship may be with your mentor. And you can always ask any of the physicians you're working with, do you have any interesting cases that I can write up? This is particularly useful if you have opportunities to shadow physicians who aren't working in academic medicine, because they don't have as many people coming to them and asking to write up case reports. So they may have cases kind of sitting around that they thought about writing up, but just they don't have the time to do it. And if you can do that work for them, it gets you an easy case report. Also, don't forget to look outside of dermatology. When you're on your clinical rotations and you see something that's interesting, that could be an opportunity for a case report. If you are seeing the patient with someone from a different specialty, but it's a derm case, make sure you run it by your mentor or someone in dermatology, because sometimes non-dermatologists will get excited about something because it's something that's interesting to them and they don't see a lot, but it might not be something that's publication worthy from the dermatology aspect. Before you start writing, you want to look in the literature to see what's already been published on this. What do you know about the disease, the differential, the treatment? What other cases have been reported? Why would anyone want to publish your case? Why would anyone care about this case compared to what's already in the literature? Don't forget to also look at the references from the articles that you find, because that may lead you to more information. And then it's not a bad idea to find your target journal early in the search, because that way you know what your word count would be, your reference and figure limit, your structure, your formatting. And if you realize that I can't really figure out why this case would be more interesting than what's already been published a lot, then don't write it up. That's not going to be a good use of your time because it's not going to get published in the end. Here are the components of a case report from the title, abstract, intro, description, discussion, conclusions, and references. And again, remember to refer to your target journal's author guidelines for what they want to be included or not included. When it comes to your title, you want to be concise and informative and make sure the information is relevant to your case. You can try to avoid redundancy in saying a case of or case report, but just pay attention to what journals want, because sometimes they may request that you do include that in the title. Don't be ostentatious saying it's the unique or the first report of. You don't have to sell it that hard, and a lot of times that makes reviewers feel challenged. All right, if you're saying this is the first case or it's so unique, I'm going to find a reason that it's not. So just present your information. It may require a title page that has things like word counts, financial disclosures, conflict of interest. So again, you're going to check those author guidelines. Some journals require an abstract and others don't, so pay attention to the author guidelines. If they do require an abstract, it's a short summary of your case, just 100 to 150 words or less usually. Kind of hits those key points of why it's interesting, the essential information, the keywords that will help people find it if they're searching. Your introduction should grab people's attention. It's a focused but comprehensive literature review. Don't go overboard. It's only a case report. They tend to be short. You want to make sure that you present to people why it's interesting in the introduction. What literature do we know about this, and how are you different than that literature? And then the final sentence kind of sets up for the case report to say, we're about to present a case of ... The case description is where you're telling the story of your patient's journey to diagnosis and treatment. Try to keep it in chronological order and be thorough. Don't bounce back and forth for things that happened here and then this happened and that if it's out of order. It gets confusing for people. Imagine that when the reader is reading the case description, they're trying to figure out what the patient has as they're reading along, just like when you're presenting a patient to an attending. You're going to introduce the patient's demographics, age, gender, sometimes race or occupation if it's relevant. Avoid protected health information like initials, date of birth, medical record number. Some journals don't even want a precise age. They want you to say things like a woman in her 50s to keep it even less specific and identifiable. And then you're going to include anything that's relevant from the patient's medical, family, clinical history, the physical exam findings, the relevant lab and imaging studies. You don't need to include them if they're not relevant. And then you can discuss your differential, management, follow-up, final diagnosis. And don't forget to include the pertinent negatives based on the disease state. What are those questions that the reader is going to be wondering about for your case? Here you don't want to do an interpretation or inference. That's for the discussion. This you're just kind of presenting the patient like you would present to an attending. In your discussion, this is the most important section. You're going to summarize and interpret those key findings. This is where you're going to really present why your case is unique. What does the existing literature already say, and how is your case different or presents a new consideration for people to think about? What value does it add to the literature? And then what are the clinically useful conclusions? Based on this case report, what should people change in their practice or keep on their differential or do differently? And then don't forget to mention limitations, and you don't have to do a comprehensive literature review. You want to focus on the literature that's pertinent to your case. If it was the presentation that was unique, you can talk about the typical presentation. If it's a new treatment, you can talk about other treatments and where they may fall short or yours presents a novel way of treating the disease. Journals may or may not ask for a conclusion statement for a case report. This, you really want to focus on that takeaway message, the lessons learned. If you can make evidence-based recommendations, that's great. This is just a few sentences. And this may be the first thing people read when they see your case report. They're either going to jump to the discussion or the conclusion to see why it matters and why it's important. For your referencing, it's all about format. Make sure it's the chronological order that you cited them during the manuscript. Use the AMA citation format, and then check your author guidelines to see if there's a limit for case reports, because there may be a limit on references, on figures, even on authors. Thank you very much. As always, we are very happy to have your feedback to make these modules better, so please scan this QR code to access the survey to provide feedback so we can make improvements.